Hi, welcome to Longevity is the New Wellness. I'm your host, Will Bozeman, and we have a very exciting episode today. We are talking to Andrea Kessler, and she is a family nurse practitioner.
Yes.
And has a great deal of experience here in Arizona, and we will ask her a lot of questions today, and we'll have a whole lot of exciting information about the field of longevity and the work that she does in health and wellness and how that can relate to this whole concept of longevity. Quickly, I did want to remind everyone watching to check out my website, willbozeman.com, and you're also able to check out the longevity platform, which is the medical platform that I work with called relative.com. It's relatyv.com, and you can have you can find a lot of great information on that website, all about longevity. Every topic available we'll have on there. Okay, let's jump into the show today.
Great.
So thank you so much for being on the show.
Thank you for having me.
Absolutely. So this is our first time meeting.
Right.
So we'll just get to know you. We might do numerous episodes down the road together if you like it and if things work out and you like the topic and all of that. So tell us a little bit about yourself.
Okay. Like you said, my name is Andrea Kessler. I've been a family nurse practitioner for about 5 years, 23 years total in healthcare. My passion is health and wellness. So we have a company called Patriot IV and ProHealth that specifically helps with health and wellness. We focus on IV hydration, hormone optimization, and weight-assisted management.
Excellent. Thank you. And I did look up your website and I saw those very things. I do have a couple of questions about what some of those things mean.
Sure.
So your background is, though, you went to school, all of your education is here in Arizona.
Correct. Yep.
Right.
So I'm an Arizona native, born and raised for 46 years.
Excellent. All right. Very exciting. Mm-hmm. Very exciting. So you might also, too, I know most people know what a family nurse practitioner is. Do you want to maybe explain a little bit, like what's the difference between a family nurse practitioner, a MD, DO, or
Sure.
even in a PA, right? They're all different levels and types of providers.
Right. So family nurse practitioner is basically a nurse that's had advanced education and training. There's different types of nurse practitioners. My specialty is family, so birth to death, basically. The thing that differentiates us from physicians or physician assistants is in the state of Arizona, we're able to practice independently, so we don't need a supervising physician, so we can essentially do everything, such as prescribing. The only thing we're restricted in doing is we can't perform surgeries or deliver babies. Physician assistants, they do have to practice under a physician, so that's kind of what differentiates us.
Okay, excellent. And so you have your own practice, what you just said earlier, Patriot IV and ProHealth.
Correct.
Those are two separate companies or one?
It's one entity.
One work together. Excellent. And that's your practice. Mm-hmm. And are you able to, just as a word out here to the national audience here and the international audience as well, you're able to accommodate someone coming to you from anywhere in the country?
Exactly. Okay. We're also mobile. So we provide mobile services, telehealth, as well as we do have a brick and mortar here in Scottsdale, so we can see patients in the clinic as well.
Excellent. Mm-hmm. Right. Okay, good. I was hoping that might be the case because if someone is listening in another state, they might want to talk to you, might like your take on all of this and want to work with your practice. And they can just reach out to you. We're going to put your information on the podcast so you can find her practice and reach out to her, and hopefully you'll get some great patients coming to you from this.
Correct.
So okay, so you mentioned something earlier, and this is not a weight loss and weight management podcast, but you mentioned weight assisted management. So what's that? What does that specific term mean?
So we do have a health coach on staff that will help provide guidance, nutritional guidance, exercise guidance, coupled with some medications as well. So it's that push to get those patients that are having a little bit of difficulty in the weight loss aspect to get them going.
Excellent. Okay. All right. So the health coach is I guess that's probably one of your secret ingredients to success, is having someone work with all the time, right?
Right. Yep. They specialize in nutrition, so they're able to help patients focus on diet and things like that, lifestyle modifications.
Excellent. One of the hallmarks of the Relative platform is a longevity coach. Right. So we're trying to a similar model where someone who's working on all these longevity metrics in their life, and we have a coaching platform for them to work with someone who's going to help them.
Right.
So it's But I have heard of great success in the weight loss field with the coaching programs.
Right. Yep. I mean, anyone can get an injection, a pill. There's no magic pill, no magic injection. So a lot of times incorporating healthy lifestyle changes will help patients in the long run.
Excellent. And I have had a couple people on the show. We talk about the difference between what a provider can do, which is what you just said, everything that you need, prescriptions and medical advice and all those things, but you're not really going to be able to, you don't have time to hold their hand, right? You just can't do it. It's impossible. So you perform there's a term that you probably are familiar with. You're working at the top of your license, right? Everything that you can do because of your credentials, anything else, there's someone else that's got certifications to do that. The more involved you get with someone, the less time you have for the other patients, right?
Exactly.
So you just can't hold hands with 1,000 people, right? You know, and guide them every day, right? But a coach can do quite a bit of that.
Exactly. Yep. Excellent. So it's been a great benefit for our practice.
Excellent. So tell us about Patriot IV. I want to hear more about this operation.
Okay. So Patriot IV, we started professional practice the fall of 2021. It was exclusive to IV hydration, mobile IV hydration at the time. And then we just expanded the other services to augment the hydration. We do provide a concierge medicine type approach. So patients do have access to providers 24/7 at any time. So they're able to reach out to me should they have questions or concerns about anything.
Excellent. So when you say mobile, you're how far out? So you're located in Scottsdale?
Our brick and mortar is in Scottsdale, but we have about 10 registered nurses on staff with us. Okay. So they're the mobile. So they provide the IV hydration component just around the valley, so surrounding areas. And we're looking to expand into other cities such as Tucson and Flagstaff. It's just we want to perfect it here first, and then before expanding.
Right. No, I could tell you stories about moving too fast and not being ready to handle the growth and the stress.
Right.
But that's great. That's great. So basically anyone in the Phoenix Valley can access your mobile services.
Exactly.
Okay. And quick question on the name, Patriot IV. What is there a story to that name?
No. The owners just liked the name, and so that's what we went with.
Excellent. Sounds good.
Yep.
Sounds good. I assume that there may have been some service members, former service members involved to call it Patriot IV.
Not immediate service members, but a big family background with veterans.
Excellent. Yep. Okay, that's great to hear. Okay, so next question I had for you is, you reference in your bio that you're a big fan of functional medicine.
Correct.
So maybe you want to kind of delve into that a little bit. What's your passion behind that? What do you see as being different or more valuable with functional medicine versus other traditional models? So
I think with modern medicine in comparison to functional medicine, I think in today's practice, providers are so quick to push pills on, rather than finding the root cause of what it is that patients' concerns or complaints are about. So we do have the ability to run pretty extensive labs, GI panels, respiratory panels that kind of dive more deep into the whole picture. So maybe it's a nutritional deficiency that's mimicking, something that could be a potential comorbidity. So rather than pushing a medication, maybe it's just implementing some IV hydration therapy on a more consistent basis to help mitigate that ailment. Okay, excellent. And I've heard a lot about functional medicine. Some of the people that I've already been on the show are very, big fans of that. So in my opinion, it's got a very strong connection to the longevity field, because you're looking at ways to help overcome the root cause of your illness issues, rather than the pill or the injection or the surgery. Right. And you need to actually work on the health aspect of it. And I feel like that's where functional medicine really shines. And it sounds like, in my limited experience with that, it sounds very successful for most patients getting into it. It changes their life. They have a completely new, vigor when they start being treated with that philosophy. Exactly. So, I was going to ask if you had any, amazing stories that come to mind. You don't have to obviously share any
personal patient stories, obviously, but
yeah, a lot of stories that come to mind, and we see this quite often, is female patients that maybe present with hormonal issues. We do a full hormone panel on them. Everything appears to be within normal range. Then we dive down more into gut health. So we'll do like a GI panel on them. We've partnered with a compound pharmacy locally that can actually target specific nutrients and supplements depending on what that patient's deficiencies are from the lab values. So we see a lot of those good success stories. So just good gut health can mimic, symptoms of other things, and coming together with the compound pharmacy has been really successful for our patients.
Well, excellent. Excellent. So the hormone side, I'm a big fan of making sure that's lined up.
Right.
It was probably 2016 and 17 when I personally was just dragging, and I didn't know why.
Right.
And it was probably 2018 or into 2019 when I started realizing something was wrong.
Right.
And went and got tested, and I don't remember the exact number, but they were shocked at how low my testosterone was.
Right.
And I was like, well, I have no idea. I just never thought twice about it. And they're like, yep, this is, it's very common,
right.
Especially obviously with a lot of factors.
Right.
Probably a lot of it is diet and exercise in general. At the time I was going through quite a bit of stress and work and all that. So a lot of things affected it, but I remember very specifically the feeling when I first started doing the injections. It was like I was carrying around a wet blanket,
right.
For all those last few years, just dragging myself to the gym, just getting out of bed and dragging myself around. And I'd still be motivated because I'm just that type of person.
Right.
But I would feel like I'm motivated, but I'm dragging this weight behind me to go everywhere, and started doing the injections and getting my levels back up. And it was just like turned me around.
Right.
I'd hop out of bed in the morning, 5:30 in the morning, and I'm hopping out of bed excited about the day. And then mental clarity,
right.
I could think clearly. I could, people would ask me a question and I could, answer pretty quickly back, better than I could before, be more focused and more clear. So it did a lot for me. And I always encourage people to take that seriously. If you're having any of the traditional depressive style, physical depressive symptoms, like what I just described, just
right.
dragging, no particular illness, no particular disease or sickness that I can point to.
Right.
And I did go to see one of my friends who's a physician, and that wasn't what he suggested. Getting a testosterone test wasn't top of his list.
Right.
It was other stuff, just everything else before that. Is that?
You're absolutely right. Most primary care physicians, it's not one of their differential diagnoses that they're thinking right off the top of the bat. A lot of times, statistically speaking, men tend to drop their testosterone levels at age 30. So they start to be depleted at that age. The success story you shared is very similar to a lot of stories that we have. We treat a lot of men for testosterone replacement therapy, and it's neat to see them complain of that fatigue, they'll decrease stamina, the brain fog. Once they start therapy, within 2 to 4 weeks, that's completely reversed. And it's really amazing. A lot of guys are like, I'm never coming off of this stuff. So it's great to see.
No, I'm glad you had those experiences. I recommend, I've had lots of friends that they're in the 30s, right? In the 30s, and they're talking about the exact same things I remember. I'm like, guys, go get your hormones tested, go get your testosterone. Right. And there's a little bit of stigma. They don't like to think that there's something wrong with them, or hormones are not something guys deal with, right? Or whatever they're thinking. And I'm just like, you know what? Just go do it, get tested. I guarantee you what you're describing to me sounds like you're low.
Right.
And you'll be grateful you did. If you want to have the energy you did when you were 18 and 20, running around conquering the world, you need to go get tested for that,
Right. A lot of times too, if you look at the normal reference range on a total testosterone level, it's very broad. It's anywhere from 250 to 1100. So a lot of physicians, if they test a patient's level, it comes back like 350, they're going to say, well, your level's normal. You don't need treatment. At Patriot ProHealth, we do treat symptoms. We don't treat numbers. So if the patient's coming to us, we've ruled out other possible comorbidities such as thyroid disease. Everything's normal in that aspect. They come back with a lower normal testosterone level. We will go ahead and start therapy. Granted that, their health history is pretty well.
Okay. So. Excellent. Yeah. I believe that too, because the numbers, they did correlate for me for the most part that I think they did, but I noticed that too with other people. Then someone explained to me the difference in the different testosterone testing items in the actual blood test. There's we don't have to go into that detail, but the free T versus the one that's bound, total T and bound, all those things make a big difference. And it takes someone that's got the skill set to interpret the lab tests and make the estimations for the patient. Like you said, it's all about how you feel, not exactly what the number on the lab sheet says.
Exactly.
And I've actually owned labs in the past, and reference ranges are a factor of lab equipment as well. So you might, you can't necessarily, take the lab test from one lab over here and line it up perfectly with this one over here. It may not have the same range system in the actual equipment. So you just go off how you feel, right?
Exactly.
I like that plan.
Yep. Treat the patient, not the number.
There you go. So in that, going on that path with the hormones as probably a first line concern for most people, in the female woman side of the hormone world, it's quite a bit more complicated.
Very complicated.
And so do you have any suggestions on that? Because I don't even have a great place to start. I don't have any personal experience with that.
So again, we partner with a compound pharmacy locally. So one of their compound pharmacists has about 30 years of bioidentical hormone experience pertaining to females. So we collaborate closely with them so we can formulate a plan together to help the female patient specifically. Males are a lot more easier. You're only dealing with primarily testosterone and estrogen. Females, we have multiple hormones to be concerned about, and you fix one's going to alter up and down. So it's a balance, and sometimes you have to shuffle them, for months before you find that balance for that patient.
Gotcha. Mm-hmm. So tying this back into longevity, this does by no means is official at all, but how important is the hormone aspect that we just discussed to someone's ambition for longevity? They're trying to add years to their life. They're trying to reduce biologic age through their blood testing and DNA testing. How important would you estimate this initial hormone concept to that whole plan?
I think it's huge. Obviously, once you get balanced hormones, stamina increases. It's making patients want to go to the gym. It's making patients want to exercise more readily, eat healthier. So I think it contributes to a lot. So getting hormones balanced and maintaining that balance is huge for longevity.
Thank you. Okay, yeah. No, I feel the same way. I'd just like to see what everyone else's opinion is on that. I've had most people do feel the same way as that, but when you're in the traditional allopathic medicine world, they don't necessarily think the same way. Of course, they're also not really aiming for longevity either.
Right.
They're really, and I don't. And again, I don't like to sound like I'm throwing those physicians under the bus on this. They're essentially needed to identify the illnesses and the sick care that people often complain about. It's not healthcare, it's sick care. I'm like, well, you want somebody who's practicing sick care when you're actually sick. Trust me.
Right.
You don't want to go to somebody who's health only when you have an infection and you actually need to get something fixed, right? Or you have an actual injury, you need something fixed. You need those skill sets. They're all needed. So I appreciate your experience on that too. Sure. On the hormone side, you've covered that pretty well, and that's actually a very, very strong component of functional medicine, right? Next thing you mentioned was the diet aspect of that. So how does the diet side factor into the hormone side, longevity side, and the functional med side? What's that?
I think diet is a huge factor with longevity and hormones. I mean, a lot of what we eat has added hormones, which can play a factor to our own personal hormones. It's huge, making that lifestyle modification, making sure you're eating healthy, plant-based diet. Again, our health coach is certified in nutrition, so she tailors each individual's diet plan based onto what they like. So following Mediterranean diets to help, decrease inflammation within the body goes a long way.
I appreciate that. Actually, I'm glad you brought up inflammation because I was going to bring that up here in a minute. That's going to be a big aspect of the show today. But you just mentioned Mediterranean diet, and so my backstory is I did go to med school, but I did not complete it to become a physician. So okay. I have some experience in a lot of the general concepts in the courses. I did the first 2 years, which is all the academics. But we talk about Mediterranean diet, and the general public, they hear the word diet, they think of a special plan to lose weight. Right. They don't think of an actual lifestyle of living. Right. But the word diet really means, the diet that you just eat. Right. It's not a special something you do for a short period of time for a temporary outcome, which is what most people associate with dieting or a diet. Right. So yeah, if you were asked somebody, what's the diet of this one animal in the wild? Well, that's their diet. They eat this stuff, right? That's what they're talking about with Mediterranean diet. You eat this category of stuff. This is what you eat. Right. And it doesn't have a particular weight loss plan, or it's not a temporary program to lose some weight before you get back off of it to your regular diet, which is, all the junk that you eat. So maybe if you feel like describing very quickly what the Mediterranean diet is, why it's so useful in longevity and in general health. Yeah, so Mediterranean diet is often a lot of plants based diet. You can eat meat and incorporate meat in the diet, but overall the health benefits to it is it's going to decrease the inflammation, that inflammatory surge that oftentimes a lot of us people walk around with on a daily basis. So obviously decreasing that oxidative stress helps the inflammatory response lower in a person's body as well. Excellent. Okay. And so as a happenstance, the Mediterranean diet is pretty much what all the blue zones around the world are following naturally. So if you were, obviously in Italy, there's some Greece, Italy, I think I can't remember all the locations, but if you look, there's a number of them around the actual Mediterranean zones where people are living to excessively, older ages and being healthy the whole time. Right. And a lot of those zones are typically mountainous, rocky, and or not just easy places to live. Right, it takes work just to get around. Right. They do physical labor up until they're 100, 120. They're actually out in the yard working and growing their own food and dealing with animals. So they stay very active the whole time. They're not living to 120 and being sick. They're living to 120 and working up until the day they die. And that's the diet that they typically have, which is what you said. It's plant-based, lots of nuts, lots of healthy legumes and of their versions of everything, and typically near the coast, if I remember correctly. And a lot of the meat and protein that they eat is largely fish and coastal type meats. Right. But again, mostly plant-based. Right. Right. So any other comments on that, or just? No, I think it's a great diet. Excellent. Yeah. Have you seen a lot of people turn their health around by sticking to that diet? I have, yes. A lot of people turn their health around. Again, it all comes down to inflammation in the body. You see a lot of patients with weight loss, even though, like you mentioned, it's not a typical diet per se. It's just a modification in the diet and how they eat. So, I've seen a lot of great results. Excellent. So, okay. Inflammation. Here we go. This is a very strong topic in longevity. Some of the writers and speakers in this field, some of the researchers, inflammation is the subject that they study. Right. It's the thing that's degrading the DNA, degrading the cells, damaging your whole system. So systemic inflammation is the enemy, right, to longevity. And they call it, a lot of times they call it inflammaging, right? And that's the term you'll hear. So maybe if you, in your own, history and experience, maybe give us your thoughts and opinions on systemic inflammation and just the general public. What do you see in these people and like most of your patients?
Right. So systemic inflammation, basically, patients can acquire some sort of illness or some sort of diagnosis that typically will affect an inflammatory surge within their body. So a lot of times lupus patients, arthritic patients, even COVID actually can cause long-lasting inflammation within the body. So again, checking specific labs like C-reactive proteins to look at those inflammatory markers and see what we can do or modify in that patient's lifestyle to help diminish or improve the inflammatory response.
Okay. Mm-hmm. And how does that integrate with IV therapy?
So some of our IV vitamin infusions actually can reduce inflammatory response mechanisms. Stress is a big factor to inflammation within the body as well. We do have some patients that we have on biweekly to monthly IV infusions to help minimize that oxidative stress, in turn reducing inflammation.
Okay, excellent. So one of my experiences is I've owned and operated with a team of people, a pain management group. We actually aren't located currently in Arizona, but we were in multiple other states. Mm-hmm. But we incorporated IV therapy into the pain model. It's a combination of electroanalgesic therapy with IV nutritional therapy.
Nice.
It works really well for pain. So the actual electrical stimulation would depolarize pain neurons, which would effectively turn off that pain inflammation cycle, mm-hmm. The brain response mm-hmm. to the actual pain issue. So it depolarizes the pain neurons, turns off that cycle, and then the IV hydrates the whole system and diffuses the inflammation that's there mm-hmm. even further. So it just really, really defuses the whole inflammation bomb that's going on. So is the anti-inflammatory effect from your IVs that you guys, use and promote, is it the contents of the IV or is it the hydration component of it, or is it both?
I think it's a little bit of both, to be honest with you. You bring up patients that suffer from chronic pain. We do see a large population of fibromyalgia patients where you can't get to the root cause of why they are in pain. So we have implemented multiple infusion packages for those patients, and we've seen a huge decrease in their flare-ups. So I think it's actually a combination of both hydration as well as the vitamins, minerals, and antioxidants that we add into those infusions.
Excellent. Yeah, fibromyalgia it's hard. It's a hard one. Yeah, we've had a lot of patients come into our offices for that as well, and they're sent to us by a lot of primary care offices, family practice, and internal med. They don't have many options.
Right.
And they don't want to go into a cycle of medications if they don't have to.
Right.
So that's a tough one.
Right. I agree.
Yeah. So let me ask you this. What is your most popular IV?
Our most popular IV is probably our Myers cocktail.
Okay. Mm-hmm. Tell us about what's in that.
Yeah. So Myers cocktail actually was made by Dr. John Myers. So he was pretty much the founder of IV nutrition therapy. He practiced in Baltimore. He did the first IV infusion probably about in the 1970s. So each mobile IV hydration company has kind of mimicked his model with alterations to some degree. So at Patriot IV, our Myers cocktail consists of vitamin C, which is helps with immune function. We have zinc, magnesium, B complex, which consists of vitamins B1, 2, 3, 5, and 6, B12, and we also have glutathione. So glutathione is a really powerful antioxidant that our bodies naturally make. As we age or when we get sick, it gets depleted. So we incorporate glutathione as part of our Myers cocktail.
Excellent. Mm-hmm. So what's the difference between let's talk about glutathione mm-hmm. out of all those ingredients. Mm-hmm. How is the IV application better than, say, an oral capsule people take, the supplement they buy?
So IV formulation goes directly into the bloodstream. So it bypasses what we call first pass. So going through the digestive system. So you get 100% absorption of that supplement versus when you consume something orally, you roughly get about 40 to 50% absorption. In some cases, we have patients that have a decrease in intestinal function, so they don't get any absorption. So sometimes Crohn's patients, patients that have had bariatric surgery that have malnutrition or malabsorption deficiencies, they may not get any absorption of that vitamin.
Gotcha. I have heard a lot about absorption issues in different vitamins.
Right.
And then I hear, obviously those same people talking about that go into a lot of the gut bacteria model, but you're talking about people with those actual illnesses that, they're not going to have very successful uptake.
Right.
And by first pass, if I remember correctly, you can correct me here, but that is your liver is processing all of the ingredients and letting everything through that it wants to let through and filtering out everything it wants to stop.
Yep.
So it just doesn't let everything through.
Exactly.
Right.
Yep.
So yeah. And then of course, I guess the other side of that is to overcome that percent of loss. People often will take more.
Right.
But that then becomes a problem with the liver itself.
Exactly.
You start adding too much stress on your liver to process all the stuff that you're, throwing in.
Right. Yep. Okay. So yeah, IV formulation, 100% absorption. So it's great.
Excellent. So you mentioned magnesium. And I know there's a few different versions of that out there that are useful, but specifically regarding sleep, I know magnesium is a great supplement to help people, get great, great sleep patterns.
Right.
So do you see that happen quite a bit?
Yeah. And in fact, a lot of times during our vitamin infusion therapies, patients will often feel like, wow, I feel pretty relaxed. It's a smooth muscle relaxant. So it helps, like you said, provide that relaxation. Some people take it orally for anxiety or before bed to help them sleep. So the magnesium we use specifically is magnesium oxide. Okay. There's different formulations.
Excellent. And I'm assuming that one is maybe recap if you know, what are the ones that people are taking orally? What's that one? Is it magnesium citrate?
Citrate.
Okay. And why is that one? Why is one used over the other for the IV?
So there, you can take magnesium oxide orally as well. I think there's 3 different types of magnesiums. Citrate specifically works in the gut. So patients that suffer from maybe chronic constipation take that to help alleviate some of those symptoms. Versus oxide, again, all magnesium, smooth muscle relaxant. So it just helps overall improve sleep patterns and diminish some symptoms of anxiety that patients may be having.
Well, that's true. Yes, anxiety would be a great assist to get rid of some of that. I know a lot of people have that.
Right.
Excellent about that. I was going to ask, do you have anybody coming back to you wearing wearables, talking about their improved sleep? Do you see any of that?
Yeah, absolutely. Yep. And as far as the magnesium, we do recommend, we have a triple magnesium complex that we recommend patients that do start weight-assisted management, because sometimes changes in diet can mess with bowel patterns. So that is something that we promote all the time with Patriot.
Okay, excellent. I know I've got a few friends in the sleep field. That's why I'm bringing this up. I actually have a doctor coming on the show in a later episode who's a sleep expert, and one of my good friends owns a sleep testing service.
Nice.
So he actually does this for medical offices. They just send the patient to him, and he does the home sleep study.
Nice.
Has a team of sleep doctors that evaluates it, and then they recommend all the therapies. And some of the therapies are just magnesium orally, but also I think he actually has a recommendation for magnesium IVs for people who want a faster onset of getting this done. Let's get to this, right? That's the people that are on testosterone, right? Give me the IV. I'm ready to go. Need to get my sleep.
Right. Yep.
So, yeah. Okay. One other aspect I was going to ask about is that you mentioned vitamin C in the Myers cocktail. So tons of great things about IV vitamin C. Maybe if you have some insight on that.
Yeah. So obviously vitamin C helps with immune function. The most recent studies in attention to high dose vitamin C have actually been linked to helping patients that suffer from cancer in conjunction with their chemotherapy. It's obviously not FDA approved, but it's in current studies. The studies and literature that have been printed have showed some promising effects for patients undergoing cancer treatment. We do have two different types of cocktails. We have the Myers cocktail and Mega Myers. So the big differentiating factor between both those infusions is the dose of vitamin C. So we have a gram of vitamin C in the regular Myers cocktail versus 6 grams of vitamin C in the Mega Myers.
Okay.
Yep.
Excellent. Excellent. So what do you think is actually, just your opinion, and what do you think is causing the beneficial outcomes with patients? I guess you're saying patients who are in chemotherapy,
right?
The vitamin C is maybe that's neutralizing some of the toxic effect
right.
of the medications.
Exactly, and I think it's targeting the T cells so that it helps. I don't really know the contributing factor to it, just other than what the literature states, but I think it just helps overall target those T cells. So patients that are getting chemotherapy, their recover time is quicker. Oh,
that's great. That's great. Well, that's excellent. So let's say you don't have any cancer issues, but you're getting regular vitamin C IVs. What would be a general health and wellness outcome from that? What do you think is occurring?
Just increased immune system. It is a water soluble vitamin, so what your body does not use, it does excrete out. Okay. I think overall it's great for immune function.
Okay. Is there any sort of dosing issue with that? I mean, if you do overdo the vitamin C?
Yes, you do have concerns for vitamin C. I don't think as far as toxicity goes, we don't go any higher than 6 grams in our protocols. So just to maintain.
Gotcha. Okay. So, thinking about how longevity works, which of the items in the Myers cocktail do you think would be the best, the one that's producing your best longevity outcomes for a patient?
I think glutathione.
Okay.
I'm a big fan of glutathione.
Okay, excellent. And that specifically is reducing inflammation.
Exactly. Yep.
Excellent.
And it does have some anti-aging components to it. There are some studies too that show that glutathione slows the effects of Parkinson's while improving brain function. So there's some good studies out there on that.
Excellent. Mm-hmm. Well, I guess that makes sense because a lot of these chronic illnesses they have a high association with inflammation in general. Mm-hmm. So it wouldn't surprise me if there's a lot of potential therapies that could do with glutathione.
Right.
Interesting. Mm-hmm. Okay. We are still good on time. I wanted to ask you, I saw on the website NAD Plus. You guys are doing those. How is that working out?
Good. We have a lot of patients that frequently use NAD infusions for us. So NAD is a coenzyme. It's found in all living cells. Again, studies, I'm a huge study person. Studies show that NAD promotes health and prolongs the lifespan of most people. It has some anti-aging components to it. Again, helping brain function, slowing down that cognitive decline and things like that.
Okay, excellent. And I've been taking orally NAD for years, but I'd imagine I'd feel quite different if I got the IV.
Right. We do. It's a little bit longer infusion. Most IV vitamin infusions roughly take about 30 to 45 minutes, but with NAD specifically, it's accompanied with some uncomfortable side effects, such as it can decrease your blood pressure. So it's a slower infusion. So we monitor patients more closely with those infusions. Okay. Mm-hmm.
Well, I know people who've been getting NAD IVs, and back, obviously during COVID, I had people that were, trying to overcome the effects of, the fatigue effects of COVID. Yeah, the long COVID with NAD IVs. Of course, I think you'd probably recommend a Myers cocktail first, right. I'm guessing, because of the overall effect, the vitamin C and the glutathione and all of that.
Right, exactly. We do have a COVID recovery cocktail. The only thing, it's very similar to our Myers. We just add a vitamin D injection.
Okay, excellent. Excellent. So the Myers is most popular and probably has you would say, the most broad-ranging health benefits.
Right.
All right. And if someone wanted to engage in an IV therapy regimen, let's say for longevity, because a lot of people I talk to and the whole, the audience for this show is largely listening to this for the purpose of longevity. There's a lot of health podcasts out there with different niches of topics of all sorts, right? But in this one, most people are looking for longevity. So if you could recommend a regimen for longevity, what do you think it would be? How often? Which one? Cycling different ones? What do you think?
I honestly think Myers cocktail is the best infusion. Again, some patients benefit from once weekly to every 2-week infusions for the longevity effect. I think it's great. It's, again, our most popular infusion.
Excellent. Have you, do you know of anyone who has done a before and after biologic age test with Myers cocktails?
I do not, unfortunately. Okay. That would be something good to explore.
It would be, yeah. I try to, our platform does before we start out with a blood test that comes with it's a relative health report. It's kind of similar to what you described, where it just outlines all the health issues going on with the patient, and it has their age score that we calculate as well. Nice. And so then we will do that again in 6 months. But in between that time, the relative longevity platform it's a tracking platform. So everything the patient is doing, they are tracking it. They take a supplement on a day. They have listed what it is they take and the dose of it as well. If they're taking other medications, if they're doing their walks, daily steps, if they're doing sonotherapy, cryotherapy, there's probably a dozen different metrics that we track. They have to enter it unless they have a wearable and it's connecting automatically, but they're only going to get certain things from the wearable. They can't, get the food and things that they eat from the wearable. Right. But they track all those things. And then the algorithm that we have is designed to give them an estimated age reduction score monthly.
Nice.
So people don't really want to get a blood test every month. But they would likely get one every 6 months. And our objective is for them to get one at 6 months so that they can see the difference. And then we can take all the activity that they've engaged in and it actually recalibrates the algorithm for that patient. So it will say, okay, so you achieved, if you started out, say you're a 50-year-old, let's say 50-year-old woman, and you got a blood test, your age score is 50. So you perfectly lined up with your chronologic age. Well, then over the course of 6 months, your blood test might come back and say that you test 5 years younger now, right? So what is it that you did that tests 5 years younger? Let's figure that out. And once it figures that out, it will start to actually more accurately describe the age reduction component for the patient. So the very first month, they're entering things in using all of the literature that's out there on these different topics, right? You've got, like I just mentioned, sonotherapy, cryotherapy, HBOT, and Myers IV cocktails could actually be IV therapy can be a whole category, right? And if they're getting those, they put that in there. What is it that we're estimating is producing this biologic age reduction? And it will calculate a predictive age score monthly. Wow. That keeps them engaged, right? So you started at 50 and now you're at 48.9. That's your predictive age score for this month. And it's going to do that every month. And when you get your actual blood test back, it'll again recalibrate. So if you had much greater success in achieving biologic age reduction with all the activities, it will give you that advantage in your next 6 month cycle of entering in data. Oh, nice. So that's the idea behind it. That would be interesting to see how IVs can impact that. Right. And again, you're mobile, so anybody who is engaged in the longevity platform, they can come out to the house. Right. So what's it like if a lot of people I imagine probably haven't had an IV. Right. So what's the I don't want to talk about this aspect of it on the show, but what's the discomfort level of the actual IV process? It's a very low risk. It's minimally invasive. Again, just providing a modality to provide those IV supplements, but very low risk. Patients do have some anxiety at the beginning, especially if they've never had, IVs at all or been to the hospital for any sort of reason. But once they get it and we provide them, they're in their own home. So I think that provides a calming effect as well. So it's usually pretty well responded to. And it's like you said, only the beginning, right? Mm-hmm. It's just like getting your blood drawn. Right. You get your blood drawn, a little bit of discomfort at the very beginning, and then you're fine. Mm-hmm. And then I think most people agree that kind of right after they start getting their blood drawn for the lab, whatever lab work they're doing, right after the actual poke is done,
right.
most of them are calmed down now. Okay, great. And this doesn't really hurt anymore, and I'm fine. Or I was more worried about it than I should have been.
Exactly.
But once the IV is set, they really don't feel anything anymore, right?
Nope. Just maybe a cooling sensation, but other than that, the fluid coming in. But otherwise, they're again, the luxury of being in their own home provides that calming effect for them. So a few minutes of the IV starting, they're pretty calm.
How soon does it take for the effects of the IV for them to notice?
It depends on the ailment. So if they're calling us because they may have like a stomach bug or hangover, it's pretty much almost immediate, for sure within several hours after the infusion's completed.
So then how long would it last? How long will the effects of the IV last?
Well, with the vitamins, it can last anywhere from a week to 2 weeks.
Oh, okay. Mm-hmm. Excellent. So a twice a month regimen could be very effective in maintaining the kind of the above average energy level, right?
Right.
Excellent.
Yeah.
Excellent. Well, I think we're right out of time.
Okay.
Is there anything else that you would want to convey to listeners about this topic, specifically your practice, IV therapy, the mobile program, anything like that?
Just that we're happy to help anyone, looking for IV hydration therapy services, hormone replacement therapy. Again, we provide that concierge medicine. So it's a little bit going above and beyond where the patient does have access to a provider 24/7, even on weekends.
Excellent. And to remind everyone listening, their practice can accommodate someone from anywhere in the country. So if you're in another state listening to this and you think that what she's talking about is something that you want to discuss further with her, then just reach out to her. Her website is going to be on the episode description. And you can say it again. What's the domain? What's the website for your?
www.patriotiv.com.
Okay, patriotiv.com. Excellent. And reach out to them, schedule a telemed visit, and they may not be able to provide mobile service to someone in another state, but we probably could recommend you to someone else who can.
Right.
But you can handle quite a bit of everything of their health and medical needs remotely.
Right.
You can write scripts and suggestions from anywhere in the country.
Exactly.
Excellent. Well, thank you so much for being on the show. I really appreciate your time.
Yeah.
And looking forward, maybe we'll see how this goes for you. If people are reaching out to you, maybe we can do another show to see what some of your successes are like with people who are engaged in longevity. I think personally, I do want to get people who are in the longevity platform here in the Phoenix Valley and get them on and encourage them to do a regular IV regimen and see if we can actually document some of the biologic age success with that.
Yeah, that would be great.
That'd be fun. So you're listening to Longevity is the New Wellness. You can reach out to me on my personal website, willbozeman.com, and the longevity platform is relative.com, RELATYV. And I would encourage you to send in any questions you have, any of my social media accounts. You can actually just reach out and ask a question on those as well. And be happy to cover any topic that you're interested in hearing about as it relates to longevity as a form of motivation for health and wellness. Thank you for listening.